So we're quickly trying to look at another concept, all right, as we continue discussing various issues in the lower limb. Now, this is what is known as the asymmetric skin folds. So you have skin folds and they are not symmetric, they are not equal. You understand? So asymmetric skin folds, do you understand? You have skin folds, they are not equal. You have two skin folds on one leg, one skin fold, or no skin fold on the other leg. All right, it could be normal in babies that are chubby. All right, so in others you could actually indicate that there's an issue underlying. You understand? So if you're having asymmetric skin fold, especially in the thighs or gluteal region, it can be a subtle clue that the infant, so it prompts you to now evaluate if the legs of the baby are also equal. Of course, if the legs are not equal, you can now start suspecting for things like developmental dysplasia of the hip. So, but here's a twist. All right, their significance have been a bit controversial. So what may indicate uneven skin creases may suggest that maybe there's hip dislocation, maybe the length of the legs are not equal. It could show that maybe there's a problem in the muscle, not really the length of the bones. You understand? So clinical relevance, most at times it has always been used to diagnose developmental dysplasia of the hip. You understand? So currently it states that isolated skin creases asymmetry is no longer a reliable screening tool for this, but it can give you an idea. All right, you see it, you further do other things to confirm. So studies shows that many infants with asymmetric folds have normal hips on imaging. Okay, false positive can lead to unnecessary anxiety. Do you understand? So when you see it, calm down, go further to see if it is normal or there's a problem. So when you see it, you can do other things like Geller's sign to see if the knees are the same, to do hip abduction to see if it is limited, you know. So to do Otto-Lanier and Barlow maneuvers to see if there's clicking or clunking of the hip when you do that. Okay, so that's it.